Have you ever looked in the mirror and noticed a coarse hair growing on your chin, even though you were certain you had removed it only a few days earlier? For many women, this begins quietly after menopause. At first, it may be one dark hair beneath the chin or near the jawline. Then another appears. Over time, checking the mirror and reaching for the tweezers can become an uncomfortable part of the weekly routine. Some women feel embarrassed by it. Others become worried that something is wrong with their bodies. And many simply assume that unwanted facial hair is an unavoidable consequence of getting older. The truth is more reassuring, but also more complicated. A gradual increase in facial hair after menopause is common, and in many cases, it reflects the natural hormonal changes that occur with age. However, facial hair does not have one single cause, and it is important not to believe that one food, one supplement, or one so-called hormone blocker can make the problem disappear overnight. Today, I want to explain what may be happening inside your body, which changes are usually harmless, which signs deserve medical attention, and how 3 familiar foods may support your overall health without making unrealistic promises. Those 3 foods are pumpkin seeds, spearmint tea, and ground flaxseed. Before discussing them, we need to understand why facial hair can become more noticeable after menopause. Throughout a woman's reproductive years, the ovaries produce significant amounts of estrogen. Estrogen affects far more than the menstrual cycle. It influences the bones, skin, blood vessels, brain, and hair follicles. It also helps maintain the balance between estrogen and a group of hormones called androgens. Androgens include testosterone and related hormones. Although they are often described as male hormones, women naturally produce them as well. In appropriate amounts, they contribute to bone strength, muscle maintenance, sexual health, and normal body function. After menopause, estrogen levels fall considerably. Androgen levels may also decline, but they do not always fall at the same rate. As a result, the effects of the remaining androgens may become more noticeable in certain tissues. Hair follicles respond differently depending on where they are located. On the chin, upper lip, or jawline, androgen activity can cause fine, nearly invisible hairs to become darker and coarser. On the scalp, particularly around the crown and part line, the same hormonal environment may contribute to thinning in women whose follicles are genetically sensitive. This is why some women notice the confusing combination of more hair on the face and less hair on the head. It does not mean your body is becoming male, and it does not mean that you have done something wrong. It means that your hair follicles are responding to a hormonal environment that has changed with age. However, hormones are only one part of the picture. Genetics influence how sensitive your follicles are. Certain medicines, hormone treatments, steroid products, and supplements may also affect hair growth. Metabolic conditions and disorders involving the ovaries, adrenal glands, or other parts of the endocrine system may occasionally contribute. The speed of the change is therefore very important. 1 or 2 coarse hairs appearing gradually over many years are usually less concerning than extensive dark facial hair developing over a few months. A rapid change should not simply be dismissed as aging, especially if it is accompanied by severe acne, a noticeably deeper voice, rapid scalp hair loss, unusual muscle development, or other major physical changes. In those situations, the correct response is not to panic. It is to arrange an evaluation with a qualified healthcare professional. Now let us consider the first food, pumpkin seeds. Pumpkin seeds are often promoted online as though they can directly shut down DAT and stop unwanted hair growth. That claim goes beyond what current evidence can reliably support. Eating pumpkin seeds should not be expected to switch off your hormones or remove facial hair that has already developed. Their real value is nutritional. Pumpkin seeds provide protein, unsaturated fats, magnesium, iron, zinc, and plant compounds known as phytosterols. These nutrients support many normal functions, including tissue repair, immune health, energy production, muscle function, and the maintenance of healthy skin and hair. Zinc is particularly important for normal cell growth and repair. However, taking excessive amounts of zinc in supplement form can create new problems, including nausea and interference with the absorption of other minerals. For most people, Obtaining zinc from a varied diet is a safer and more balanced approach. A small serving of unsalted pumpkin seeds can be added to oatmeal, yogurt, salads, soups, or cooked vegetables. They may also be eaten as a snack alongside fruit. The important point is not to treat pumpkin seeds like medicine. Their value comes from making the overall diet more nutritious. When pumpkin seeds replace cookies, chips, or other highly processed snacks, they may help you feel full for longer and make it easier to maintain a more stable eating pattern. This can support weight management, blood sugar control, and general metabolic health. Those factors matter because the body's hormone systems do not operate independently. Sleep, physical activity, insulin sensitivity, stress, nutrition, and body composition all interact with one another. Improving these foundations may not make facial hair disappear, but it can support your body far more effectively than relying on one so-called hormone-blocking food. The second food is spearmint tea. Spearmint is interesting because a small number of studies have examined its possible effects on androgen measurements in women with excessive hair growth or certain hormonal conditions. Some of those studies have reported changes in free testosterone after women drank spearmint tea regularly. However, the studies were generally small, lasted only a short time, and often involved younger women with conditions such as polycystic ovary syndrome. That means the results cannot automatically be applied to every woman over 60. A change in a blood test also does not necessarily mean that visible facial hair will quickly decrease. Hair follicles grow in cycles, and meaningful changes in hair growth usually take much longer to observe than changes in hormone measurements. Still, plain spearmint tea may be a reasonable beverage for many adults. It is naturally caffeine-free and can be used in place of sweetened drinks, sugary coffee, or evening beverages that may disturb sleep. 1 or 2 cups of ordinary spearmint tea may fit comfortably into a healthy routine if it agrees with your digestion. There is no need to prepare extremely concentrated tea or consume large amounts. It is also important to understand the difference between tea, concentrated extracts, and essential oils. They are not interchangeable. A concentrated herbal product may expose the body to a much higher amount of active compounds than a normal cup of tea, and a stronger product is not automatically safer or more effective. Anyone taking several prescription medicines, receiving cancer treatment, or living with kidney or liver disease should speak with a doctor or pharmacist before using concentrated herbal products regularly. For most people, the sensible approach is simple. Enjoy spearmint tea as a beverage, not as a guaranteed treatment. The third food is ground flaxseed. Flaxseed is often called a hormone-balancing food because it contains lignans. Lignans are natural plant compounds that intestinal bacteria can transform into substances that interact weakly with estrogen-related pathways in the body. This has led to many exaggerated claims. Flaxseed does not act in the same way as prescription estrogen, and it has not been proven to correct every hormonal imbalance or eliminate facial hair after menopause. Its clearest and most reliable benefits come from its nutritional composition. Ground flaxseed provides fiber, plant-based omega-3 fat, and several beneficial plant compounds. Fiber supports regular bowel function, helps promote fullness after meals, and can contribute to healthier blood sugar and cholesterol levels as part of an appropriate diet. These benefits become particularly relevant after 60. Reduced physical activity, changing appetite, medication use, and lower fluid intake can all contribute to constipation and digestive discomfort. Adding fiber gradually can help, provided the body has enough time and fluid to adjust. Flaxseed should generally be ground rather than eaten whole. Whole flax seeds may pass through the digestive tract without being completely broken down, which limits the amount of nutrition the body can absorb. You might begin with a small amount of ground flaxseed mixed into oatmeal, yogurt, or a smoothie. Starting gradually is important because adding too much fiber too quickly may cause bloating, gas, or changes in bowel habits. Drinking sufficient fluid is also important. More is not necessarily better. Large amounts of flaxseed are not more likely to stop facial hair, and they may interfere with digestion or affect the timing of medication absorption. If you take blood-thinning medicine, diabetes medication, thyroid medication, or several prescriptions each day, Ask a healthcare professional how to separate flaxseed from your medicine schedule. Pumpkin seeds, spearmint tea, and ground flaxseed can all contribute something useful to a healthy diet. Pumpkin seeds provide minerals, protein, and beneficial fats. Spearmint tea is a caffeine-free beverage with limited but interesting research behind it. Ground flaxseed provides fiber, healthy plant fat, and lignans, but none of them should be presented as a cure. This distinction is important because nutrition should support your health, not create false expectations. If unwanted facial hair is affecting your confidence, it is completely reasonable to use a safe cosmetic method to remove it. Tweezing a few hairs does not create a hormonal disorder. It does not increase the amount of testosterone in your body, and it does not cause new follicles to form. However, repeated plucking can irritate the skin, cause inflammation, and sometimes lead to ingrown hairs. Shaving is another option, and despite a common myth, shaving does not make hair grow back thicker. The hair may feel rougher because the razor cuts it across its widest point, leaving a blunt edge. The follicle beneath the skin has not changed. Threading, waxing, and depilatory products may also be helpful, although sensitive or aging skin may react more easily. Testing a small area first is wise. Laser treatment may reduce dark hair by targeting pigment inside the follicle. Its effectiveness depends on hair color, skin tone, the equipment used, and the experience of the person providing the treatment. Gray, white, and very light hairs often respond poorly because they contain less pigment. Electrolysis may be more appropriate for some light-colored hairs because it treats individual follicles, but it usually requires several sessions. A dermatologist can help you choose the safest and most effective approach for your skin and hair type. Medical evaluation becomes especially important when the change is sudden. Please speak with a healthcare professional if facial or body hair begins growing rapidly, if scalp hair starts thinning quickly, or if the change occurs alongside severe acne, voice deepening, unusual muscle growth, pelvic discomfort, abdominal swelling, or other symptoms that concern you. You should also mention any testosterone creams, hormone pellets, steroid medicines, bodybuilding products, or supplements you may be using. A doctor may review your medication history, examine the pattern of hair growth, and decide whether hormone tests are appropriate. Testing one hormone in isolation is not always useful. The results need to be interpreted alongside your symptoms, medical history, and physical examination. In many women, the conclusion will be reassuring. The change may simply reflect menopause, genetics, and increased sensitivity of the hair follicles. In other cases, adjusting a medication or treating an underlying condition may make a meaningful difference. The purpose of seeking medical advice is not to frighten you. It is to make sure that an important change is not dismissed without proper consideration. Rather than building your entire routine around 3 foods, focus on the broader habits that support healthy aging. Eat enough protein to protect muscle. Include vegetables, fruit, beans, whole grains, nuts, and seeds according to your individual health needs. Reduce heavily processed foods that make it difficult to control appetite and blood sugar. Stay physically active and include strength-building exercise when it is safe for you. Protect your sleep and manage stress as realistically as possible. Within that pattern, you can enjoy pumpkin seeds, spearmint tea, and ground flaxseed. Give these foods the right responsibility. Their role is to nourish your body. Their role is not to perform a miracle. Hair changes also require patience. Hair follicles move through slow growth and resting cycles. Even treatments that have strong medical evidence generally require several months before their effects can be assessed. Be cautious with products that promise dramatic changes within a few days. Instead, observe what is happening. Notice whether the change is gradual or sudden. Take an occasional photograph in similar lighting if you want to monitor the pattern. Make a note of any new symptoms, medicines, or supplements. Bring that information to your next medical appointment. This gives your doctor something useful to evaluate and protects you from spending money on a different online remedy every week. Most importantly, remember that facial hair does not take away your femininity, dignity, or value. Many women were never told what to expect after menopause. They were not prepared for changes in their skin, body composition, sleep, hair, or emotional well-being. When they raise these concerns, They are sometimes told that it is simply vanity, but your comfort matters. Your confidence matters. The way you feel when you look in the mirror matters. You deserve accurate information, safe options, and a thoughtful medical response when one is needed. Pumpkin seeds, spearmint tea, and ground flaxseed can be part of a nutritious diet. They may support several areas of health that become increasingly important after 60. But they should not be promoted as guaranteed treatments for unwanted facial hair. Use food to nourish your body. Use cosmetic methods when they help you feel comfortable. Seek medical guidance when a change is sudden, severe, or accompanied by other symptoms. Your body is not betraying you, and you are not failing at aging. Your body is changing. When you understand those changes, you can respond with knowledge instead of fear, with practical action instead of shame, and with the confidence that you are still in control of how you care for yourself.